Knock, knock.
Yes,
Can I come in?
absolutely.
I'm opening the door, closing the door, pulling the curtain. My name's Alexa. Nice to meet you. I'll be your nursing student today. I'm going to be performing a physical assessment on you. How are you doing?
I'm well. How are you?
I'm pretty good.
Great.
Can I check your wristband? Okay, can you state your name and date of birth for me?
Casey Knapp, 5401.
All right, thank you very much. Okay, so like I said, I'm going to be doing a physical assessment on you today. And I'm just going to make sure you're in pretty good health. Do you know where you are today?
I am at this house doing a assessment.
Yes. Okay, thank you. And do you know what the day is today?
It's late July.
It's late July. Okay, thank you. All right, so the patient is awake and alert and oriented ×3. And the patient seems to be in good health. The skin looks good and her symmetry is good. She has good range of motion and she seems to be, like I said, in very good health. So now that I've made sure my patient looks good and I've asked her the general questions, I'm going to do my hand hygiene here. All right, before I touch her, and we're going to get into the vital signs first. Is that okay?
Absolutely.
All right, perfect. So first, I am going to first let me check your pulse. Okay. Okay, so I got that pulse would be 88, and then I got that her respirations is 16. Okay, so again, everything's pretty good, healthy, and you seem to be doing good. All right, so now I'm gonna do her pulse ox. I'm gonna put this little thingy on here. All right, gonna give it about a second or two. All right, so it says that her pulse ox is 98% on room air. All right, and then I'm gonna do the blood pressure. Thank you. Blood pressure was 124/85, and I'm gonna now check her temperature with an infrared thermometer. Beep. Okay, so her temperature is 98.7, all right, which is good. That's an overall good temperature for someone. I'm gonna start with the head, neck, and eyes, and I just have some general questions for you. Do you have like frequent headaches?
I do.
You do? Okay, and how often do you get them?
Maybe once or twice a day, or a week at the end of the day.
Okay, and do you take any medicine for them?
Tylenol.
Tylenol, okay. Have you ever had any concussions?
No.
No? Okay. And do you ever have any pains, like in your neck when you're moving it?
No.
No? Okay. All right, thank you. So now I'm just going to do a general survey of the head, neck, and things like that. Okay, so her symmetry is good, and I'm going to check her hair. Okay, there's no signs of manifestations or anything, and there's no dryness, nothing like that. Everything looks symmetrical, the hair distribution looks good. And I'm now gonna check her ears, if you don't mind. Okay, looking in them, there's no discharge, and she seems to be hearing fine. So now I'm gonna continue to check her nose and her face. So her skin on her face looks good. It's equal to the color that she should be, right? And now I'm just gonna take my pen light here and look up your nose a little bit. Okay, so the mucous membrane looks good, and it's dry, but it's moist, and there seems to be even hair distribution, all right? Now, I'm actually gonna take this and put it through your eyes, okay? So if you could just watch it, and then I'm also gonna put it in and out, and if you could follow it, okay? Okay, and I'm just gonna go in. And out. All right, thank you. Okay, so her eyes and her pupils are equally round and accommodated to light, and they're reactive as well. Okay, so I'm going to be checking her mouth to make sure it's moist and there's no cracks. I'm just going to take my pen light and look into it. All right, I see good moisture, and the uvula in the back is good and intact, and she says she doesn't have any soreness or anything, so that's good. There's no cracks on the lips, which means that's also moist. And I'm gonna move down to her throat now and just take a look and feel and make sure the lymph nodes aren't swollen and the thyroid, and make sure that that trachea is on the midline. Okay. There's no lumps, nothing out of the irregular. All right, and I'm just gonna feel for your carotid and just make sure everything seems okay. Okay. All right, I feel equal and bilateral on both sides, and it's pretty strong, +2. All right, and now, again, the skin looks good, still all the way down, hair evenly distributed. Okay, I'm gonna go into checking her respirations. I'm just gonna listen to the sounds and make sure that there's no bruits or any crackles or anything abnormal. I just have a couple questions. Okay, do you ever have difficulty breathing?
Nope.
Okay, do you exercise?
I do.
Okay, how many times a week?
Probably 5 days a week, 30 minutes.
Wow, that's really good. Okay, and do you ever get like out of breath pretty quickly, or?
No.
No. Okay, all right, good. Okay, so I'm just gonna listen on the anterior and the posterior side. Each time I put my stethoscope on your chest, if you could take a deep breath for me. Okay. Everything sounds equal on there. Okay, now I'm gonna move to the posterior side. Okay, one more. Thank you. Okay, so breast sounds sound equal, and again, I hear no cracks or like wheezes, nothing like that. Her chest is equal as she breathes. There's no intercostal muscles being used, and she seems to be in good health. So now that I've assessed her respiratory, her head and neck and throat, I'm going to move on to the cardiac part and the abdomen portion of the assessment. So just a couple questions to start. Do you have any history in your family of heart disease or anything?
I do not.
Okay. And do you have any heart murmurs yourself or any abnormalities? Okay.
I do not.
So obviously we're not going to take off the shirt today, but if I was, I would be looking at the color and the symmetry and just making sure everything looks good underneath the shirt, which it is. She's in good health. And then I would just listen to the 5 landmarks of the heart. But first, your vital signs were very good. You had 16 respirations, which is always good in a minute. And then you also had, for your heart rate, it was 124/85, which is within normal limits and always good for our age. So I'm gonna listen now. And okay. So I'm listening to the apical pulse. Okay. I'm gonna listen to the pulmonic. Okay, listen to the herbs point. Okay, good. S1, S2 sounds. Listen to the tricuspid. Okay, and for the mitral. Okay, so I hear no murmurs or anything not within the normal range. For your abdomen, I just have a couple questions. Do you have any pain or tenderness on a daily basis?
I do not.
And what's your appetite like?
I normally eat 1 to 2 meals a day, snacking in between. It's okay.
Okay. All right. And do you normally feel that, like when you eat, like you feel full and everything like that?
I do.
Okay.
Yeah.
All right. Good. All right. And that completes the questions. Now I'm going to do the abdomen portion of the assessment. So first, again, there is no distension. There are no umbilical hernias that I see. And there is no abnormalities. Skin is good. There is not a bunch of hair. The hair distribution is good. Okay, now I'm gonna check the vowel sounds in each quadrant and make sure that they're active. Starting with the right lower quadrant. The right upper quadrant. The left upper quadrant. And the left lower. Okay, so definitely active vowel sounds in all 4 quadrants. And again, there are no abnormalities. She felt no tenderness or distension. And I am gonna palpate just a little bit and make sure that she doesn't feel any tenderness anywhere else. Feel any pain?
Nope.
Okay. All right. So it seems everything's within normal limits, and again, she has no pain, so it's good. Okay. So we finished all the other assessment parts, and now we're moving on to the musculoskeletal portion. So first to start, I just have some general questions. Do you have any like coordination problems?
Nope.
Do you have any gait or balance problems?
Nope.
How about limitations on any range of motion or muscles, joints?
Nope.
Okay. All right. Perfect. So for the general overall appearance, the hair distribution still looks good. Everything's bilaterally equal and symmetrical. She has no abnormalities throughout. The skin texture and color still looks great. So to start, I'm just gonna ask you if you actually could just roll your neck a little bit. All right. Do you have any pain, tenderness? No?
No.
Okay. All right. Perfect. And then if you could move your arms up like this. All right. Do a little circle for me.
No pain.
Oh, I hear little cracks, a little circle back. Right. Thank you. Okay. So overall range of motion is good. It's a 5 out of 5. All right. And now with the strength, you could squeeze. Okay. Yep. Push down. All right. And now push up for me. All right. You can squeeze my fingers. Perfect. All right. So grip strength, definitely a 5 out of 5 as well. All right, and now I'm gonna move down to the legs. All right, so if you could lift them up, down. All right, I'm gonna press up. Okay, push down. Thank you. All right, push on my hands. Push on my hands. Okay. All right, push up, push down, push forward, and push back. Okay, so 5 out of 5 on the legs as well, on the strength and on the motion. Okay. If you could like maybe lift your leg up with your ankle and do a little range of motion on the ankle. Thank you. On the one. Yeah, thank you. Okay, perfect. All right, and now I'm gonna actually do the deep tendon reflex. Tap. Perfect. All right, and then we would also do it on the bicep. We'd do it on the finger, and we would check for a positive muscle twitch on the bicep. I'm gonna do a little cap refill check because I didn't get to do that earlier back in my test. So, all right, good. Circulation all around, good. Okay, so I'm gonna check the pedal pulse. All right, thank you. Okay, it takes a little bit here to find this one. All right, perfect, right here on the top. All right, definitely 5 out of 5 strength, bounding. Okay, and then I'm gonna have you, if you can, do you mind standing up? All right, perfect. Good gait balance as she stands up. If you don't mind, reach down, touch your toes, and I'm gonna check for scoliosis. Okay, so I see no curvature of the back. All right, spine is straight, And do you feel any pain or anything?
I do
Okay,
not.
perfect. All right, so if you don't mind, I'm gonna have you touch your foot in front of you and walk forward. All right, thank you. Okay, if you could come back, maybe take it to the couch. The camera can see you. Very nice. Thank you. Okay, perfect. All right. So then if you don't, okay, so the gait and balance, everything is good. 5 out of 5. All right, and then if you don't mind, lift your legs a little bit. Perfect. Okay. All right, so again, color and everything is asymmetrical, equal bilaterally, and everything's perfect like that. So if you don't mind, close your eyes. And I see no movement. The balance is still good. The gait is off, or not off, sorry. And okay, so if you don't mind, you can go ahead and take a seat. I'm going to assess for the cranial nerves. All right, so there are 12 cranial nerves, and starting with the olfactory nerve, which is smell. I could do anything as far as just taking this coffee.
It smells like caramel.
Yeah. All right, so that's a caramel coffee, and she can smell the caramel, so she can smell. Starting with the second one is the optic nerve, which is the vision, where you have to make sure they can see, and the acuity of everything, which her vision is good. She has the full field. At the doctors, what would they tell you your vision would be?
About 20/20.
All right, perfect. So she has definitely full acuity. The third cranial nerve is the oculomotor, which is for the reflexes of it. And obviously she's moving her eyes and everything, so we know that her eye muscle and movement is all good. As well as the trochlear, which is the fourth, is also a motor movement with the eye. And then you have the trigeminal, which is also for sensory and ophthalmic. And that's also obviously that she has all of those going on. She can move her eyes every way, up and down. I shone the light into it. Then we have the abducens, which is also movement of the eye, which she also has all of that. And you have the facial, which is taste. So if I gave her like a strawberry or something, she could identify the taste. And then we have the vestibulo-ocular, which is the gag reflex. So I would normally, for this test, take a stick and put it down like on her tongue and make sure that she was gagging and that the reflex was there. But the vestibular cochlear cranial is about the balance, which we just tested in the Romberg testing, and the gait and that we watched her stand up and move. Okay, and then we also did the glossopharyngeal through the swallowing. If you could just swallow for me. All right, perfect. And also we checked the tracheal earlier, so we already knew she was swallowing well then. And then we also have the vagus, which is also muscles of the throat and the mouth, and the accessory, which is for the muscles or in the shoulders. If you don't mind, shrug them for me. All right, so we know that she's good and that they're reflexing. And then we also have the hypoglossal, which is also going to be with the movement of the mouth and the throat. And we already know that that is also reflexive. So those are the 12 cranial nerves, which she has all of them. They are good. And yeah, so her strength in the upper and lower extremities is all good, and she's healthy. So now that I've completed all of the assessments for the head to toe and the physical assessment, do you have any other questions or anything like that?
I do not.
All right, and do you have any concerns?
I do not.
All right, perfect. So that completes the assessment. I'm going to do my hand hygiene again, pull the privacy curtain, and make sure my patient is safe, and that's it.